Cindy Fowler founded Cowgirls and Cocktails, now Cowgirls Against Cancer, a part of the Pikes Peak or Bust Rodeo Foundation to promote breast cancer awareness. For her service to soldiers and families of Fort Carson, Fowler was inducted into the Good Neighbor program in 2011. Sadly, she died after a 4-year battle with breast cancer in February 2012. To memorialize Cindy's legacy of generosity and vision of caring for soldiers and families, our organization renamed the breast clinic at Evans Army Community Hospital as the Cindy Fowler Breast Imaging Clinic in January 31st, 2014. Every year we've had the opportunity to support our community partners in their breast cancer awareness endeavors and breast cancer education services throughout the region. Whether it be $500 for a pamphlet set or $5,000 to support our families for items that are not covered through TRICARE, Cowgirls Against Cancer has graciously supported our organization. Every dollar donated is given to and supports a direct family member or active duty family member within the region. I'd like to introduce Dr. Johnson, the chief of the Breast Imaging Clinic, Cindy Fowler Breast Imaging Clinic within Evans Army Community Hospital. Dr. Johnson, I have a few questions for you.
Sure.
Okay. Can you explain why it's important for us to screen for breast cancer?
Absolutely. So breast cancer is the most commonly diagnosed cancer in women in the United States, with approximately 250,000 cases every year diagnosed. It's also the second most common cause of cancer death in women in the United States, with approximately 40,000 deaths every year for breast cancer. So breast cancer screening has been proven to decrease mortality of breast cancer patients, and so that's why we do it. If you were diagnosed with breast cancer in the year 1975, the average woman had a 75% chance of being alive with breast cancer 5 years later. That is significantly improved to 90% today. If you're diagnosed with cancer today, you have a 90% chance of being alive 5 years from today. And the biggest difference in that improvement has been breast cancer screening.
So, sir, what is the recommended schedule? What do you recommend for routine screening needs?
Yeah, good question. So basically, the reason that breast cancer screening works is because of early detection. So the whole point is to detect cancer early. So we recommend, as does the American Cancer Society and American College of Radiology, that women start at the age of 40 and get annual screening for until at least the age of 55. After the age of 55, it's okay to go down to every 2 years, but that's a decision that should be made based upon an individual woman's risk factors. Now, that's for a normal risk woman. If you are high risk for some reason, then you really should undergo screening more often than that, and with different modalities as well.
So, within our military facility, what services, what capability do we have to detect or diagnose breast cancer?
So here in the Cindy Fowler Breast Imaging Clinic, we have a digital mammography machine where we do screening mammography as well as diagnostic mammography. We are excited that in the very near future we're going to have a 3D tomosynthesis machine that we'll be able to offer to our patients. We also have over here a breast ultrasound room that we use every single day for diagnosis and detection of breast cancer, as well as a stereotactic breast biopsy machine that we use for diagnostic purposes. So Lori, how do we use the gifted donations from Cowgirls Against Cancer here at Evans Army Community Hospital?
Well, we do it a variety of different ways. We do active outreach with the Cindy Fowler Breast Clinic. Population Health and Cindy Fowler Breast Clinic reach out monthly to ask our patients to come in to get their routine, regular mammography screening. Then we also do what's called a breast cancer gift campaign. So in October, we have Breast Cancer Awareness Month. So we do a rodeo. We ask every patient that's overdue or way overdue for their screening to come in, and we do that with a gift bag option. We have a sample of those by Dr. Johnson there. So oftentimes they're filled with materials full of education, how to recognize signs and symptoms of cancer, and some of the shower cards. So these are some of the samples that we've had over the year. Okay, and during that time we set up educational booths and we talk about how to recognize lumps and how to self-exam and the value of self-examination. So these are all items that have been purchased through the funds that have been raised by Cowgirls Against Cancer over the last 10 years, and we use these items every day in the facility and in all of our outreach endeavors.
And what resources have we used to educate our patients?
So some of the things that we particularly have done is that we have purchased models in which to teach, and so each clinic has a model in which to teach. So when they have patients that come in and talk about breast pain, which is a common diagnosis, but it happens in almost every element of life, of a woman's life, we have models that they can Providers can teach the patients about what to tell everyone about the pain and to track the pain. So they come in to see Dr. Johnson's team, they know where the lump is, where the mass is, where the pain is. We also provide information to them about what to expect for breast biopsy. We do it in a variety of different languages. We also talk about how to care for your breasts, whether you have breast implants or you've already had biopsies done. Some of these factors change the plan of your care. So we provide that information to our patients, and we make it available here in the clinic and all of the clinics within, the radiology clinics within the Front Range region, actually. Every donated amount supports a military family here in the Pikes Peak region. We want to thank Cowgirls Against Cancer for their continued support and generosity to the Cindy Fowler Breast Clinic.